The Modalities exam is a critical component to protect the integrity of the profession and ensure the public is protected. For this exam, candidates have 18 minutes to complete 3 acupuncture techniques. They must adhere to best practices for clean needle techniques and infection prevention and control principles. Please note that the photos and videos in this video are for illustration purposes only. The actual exam setting may differ from what is shown, and candidates may use their preferred acupuncture supplies as long as they meet regulatory and safety requirements. The Modalities exam is a prompted exam where candidates must follow the examiner's instructions. Some prompts involve a single action, while others require several steps. This video will help candidates understand what to expect during their exam. To succeed, candidates should avoid making errors and critical errors. An error will significantly reduce your score, while a critical error results in an automatic fail. Candidates who fail this exam have usually accumulated too many errors or demonstrated unsafe techniques that resulted in a critical error. This video does not cover all possible errors. It is the candidate's responsibility to illustrate proper techniques throughout the exam. Once candidates walk into the exam room, they will be greeted by their examiner using their candidate ID. The examiner will use a standardized script. They will show the timer, state the exam time limit, and start the timer. In the exam room, there is a treatment table with a mannequin on it, a desk or counter space, and an exam worksheet. The worksheet has instructions about the acupuncture points to be needled for each step. It is recommended that candidates leave their kit on the floor, leaving sufficient space on the desk and counter space for a workspace setup. The workspace may be on the candidate's left hand or right hand side when facing the treatment table. It is recommended that candidates become comfortable performing techniques from either side. Some candidates choose to review the acupuncture points and make note of the needles and needling depth they will use prior to the first prompt. Candidates can refer to the worksheet and make additional notes at any time during the exam. The worksheet will not be graded. Once the candidate is ready, the examiner will begin with the first prompt. During the exam, candidates must verbalize every instance of hand sanitizing when necessary. Physically performing the hand sanitizing step is not necessary. Simply state, "I wash my hands." If you have any lesions present on your hand, it is not necessary to wear gloves, but you must state, "I will use gloves." Be sure to verbalize and clearly explain the appropriate steps for hand sanitizing when wearing gloves. It is considered a critical error if you fail to demonstrate glove use when your hands show lesions. Prompt: set up an appropriate sharps container. Action: retrieve the sharps container from the kit and place it on the counter space provided. Tips: taking a moment to visualize the workspace setup beforehand can be helpful. Error: using an inappropriate sharps container is considered an error. Prompt: set up a waste container. Action: set up an appropriate waste container on the counter space provided. Error: not preparing a waste container for the kit is considered an error. Prompt: set up a clean field. Action: apply knowledge of clean needling techniques and infection prevention and control, including hand sanitizing for setting up a clean field. Tips: to receive a full score for this prompt, the candidate may need to verbalize actions such as hand washing and workspace preparation. The clean field must be well packaged to preserve its cleanliness. Ensure the clean field is large enough to prevent compromising acupuncture supplies. Error: it is considered an error if the countertop is not cleaned and disinfected prior to clean field setup, or if the clean field is compromised during setup. Prompt: consult your candidate worksheet and place at least one appropriate acupuncture needle for each step on the clean field. Action: retrieve the needles required and place them on the clean field. Tips: although the travel kit can be accessed at any time for more needles, it is recommended to place sufficient needles, including a few extras, on the clean field. Having to access the travel kit may disrupt a candidate's concentration. Prompt: place at least 3 pre-packaged alcohol swabs on the clean field. Action: retrieve the alcohol swabs required and place them on the clean field. Prompt: place some cotton balls on the clean field. Action: retrieve the cotton balls required and place them on the clean field. Prompt: proceed with Step 1, Acupuncture, on the candidate worksheet and follow that instruction. Action: following best practices, select an appropriate needle and demonstrate needling at the general location of the acupuncture point according to the worksheet. Assume that the mannequin is a 165-pound male of average build. A candidate may demonstrate the needling technique on the mannequin itself or move the high-density pad to the needling area and demonstrate needling on it. Tips: demonstrate the appropriate angle, depth, and direction for the indicated acupuncture point. Also demonstrate the tonifying or reducing technique. Prompt: please confirm the length of your needle for this step. Action: state the needle length used for this step. The examiner will use a ruler and a protractor to confirm the needling depth and angle. Critical error: unsafe needling in areas that could damage the heart, lungs, or the central nervous system is considered a critical error. Prompt: withdraw the needle and dispose of it appropriately. Action: remove the acupuncture needle safely and dispose of it into the sharps container. Error: it is considered an error if the needle is not disposed of appropriately. Prompt: proceed with Step 2, Moxa on a needle, on the candidate worksheet and follow that instruction. Action: demonstrate appropriate needling and then put a Moxa cone onto the needle. Demonstrate lighting the Moxa. For example, use an incense stick to touch the Moxa cone. Do not actually light the Moxa on fire. Tips: follow best practices when performing these steps to prevent losing point. Error: avoid using an inappropriate needle or heat shield for this step and ensure the Moxa is securely placed on the needle before lighting it. A critical error if no heat shield is used for this step or if the demonstration is considered unsafe for the patient. Prompt: safely remove the Moxibustion cone and supplies. Action: remove the Moxa cone from the needle, assuming that the Moxa cone is still burning and the needle is still hot. The demonstration must ensure patient safety. Error: be cautious to avoid any errors or critical errors, such as mishandling of flammable materials or dropping the burning Moxa cone onto the patient. Prompt: withdraw the needle and dispose of it appropriately. Action: remove the acupuncture needle safely and dispose of it into the sharps container. Prompt: proceed with Step 3, fire cupping over a needle on the candidate worksheet and follow that instruction. Action: move the high-density pad to the general location of the acupuncture point. Demonstrate appropriate needling and then fire cupping over the needle. Verbally indicate that the cup has been pre-sanitized. Proceed with demonstrating fire cupping over a needle. To successfully complete this step, candidates must achieve suction on the high-density pad. Ensure to follow best practices for fire cupping safety. Errors. Errors that could occur during this step include holding a flame directly over or too close to the patient's body, no mention of proper pre-sanitized cup, mishandling of flammable materials, the needle pushes the cup deeper, the flame overheats the mouth of the cup, failure to achieve suction with the cup. Prompt: remove the cup. Action: remove the cup using the appropriate technique. Prompt: withdraw the needle and dispose of it appropriately. Action: remove the acupuncture needle safely and dispose of it into the sharps container. Prompt: this station is now complete. Please pack up and exit the room in a timely manner. Action: the exam is complete. Candidates should pack up their supplies and exit the room. Thank you for watching this video, and we wish you the best of luck on your exams.